Malawi is a country in southern Africa, roughly the size of Pennsylvania, with a population of 18 million. The country is among the poorest in the world and an HIV hotspot, where 1 in 6 adults is living with the virus in the highest prevalence areas. The vast majority of Malawians reside in remote, rural areas where the nearest health facility is often a day-long walk away. Most are subsistence farmers, living well below the per capita gross national income of $250 a year. Due to entrenched gender inequality, girls face even more challenges, including low rates of school completion. With few prospects to earn a livelihood, poverty often drives transactional sex and early marriage, increasing the risk of domestic violence, adolescent pregnancy, and sexually transmitted diseases, including HIV, for which girls and young women bear the highest burden of new infections. Through its Nursing Scholars Program, the Global AIDS Interfaith Alliance, GAIA, provides a bridge for some of Malawi's most vulnerable young women to overcome social bias and achieve economic empowerment, gender equality, leadership potential, and fulfilling careers. The program also helps build capacity in Malawi's severely understaffed healthcare system, where nurses provide the vast majority of care. This nursing shortage has been exacerbated in the past 2 decades by the loss of nurses to AIDS and immigration to developed countries with better wages and working conditions. Today, Malawi has only 3 nurses per 10,000 people, compared to 50 in South Africa and 100 in the United States. GAIA is a secular nonprofit that has been working in Malawi since 2000, delivering innovative healthcare programs to those most affected by HIV and AIDS, malaria, and tuberculosis. GAIA's programs seek to empower girls and women, emphasize disease prevention, and expand healthcare access. While GAIA is not affiliated with any religion, our name recalls an early grassroots approach, incorporating leaders of all faiths as important community influencers and messengers on health topics. GAIA's programs are developed in-country by local staff based on the local context and focused on strengthening systems and developing capacity as a means to real and sustainable change. GAIA nursing scholars are young women, ages 17 to 24, from extremely impoverished backgrounds. They have often faced huge obstacles to pursue an education, including caring for and supporting younger siblings, heading orphaned households, and living in extreme poverty. 63% of the scholars are orphans, and 3/4 are from rural areas where educational attainment is low and where the healthcare worker shortage is most severe. In exchange for support, scholars commit to giving back by working in public health facilities for 4 years. Each year, more than 100 students apply for approximately 20 spots. GAIA provides wraparound support, including a stipend for living expenses and supplies. GAIA also provides careful monitoring of progress and academic or social support when needed. This has resulted in on-time graduation and improved pass rates, competency, and readiness for practice upon graduation. GAIA works with the Ministry of Health to ensure graduated scholars are placed at work sites and remains in contact with deployed scholars as they adjust to new professions. In addition to lifting the young woman, her family, and community, steady employment with a solid wage is critical to national economic development in low-income countries. In 2000, the World Bank changed its policy to strongly support the need for higher education as essential to economic development on the African continent. And while programs to help girls complete secondary school are critical, there is far less support for higher education, particularly for girls from poor rural areas, who are often less prepared to cope with the challenges of attending university. GAIA is proud to be one of the few nonprofits in the region working to meet this special need for support at the tertiary level.
I saw that school is really important. I just wanted to become somebody. I was put on the GAIA scholarship. They paid for my tuition fee. Everything was provided for me. And I can't thank GAIA more, but only God knows they've done a real good job putting me to be in a place where I am today.
Today, approximately 10% of registered nurses in Malawi are GAIA supported. More than 2/3 report using their stipends or salaries to provide for younger siblings. 95% have fulfilled their commitment to work in the public sector. And 99% have remained working in Malawi even after the 4-year commitment. Dining for Women's support will directly result in 20 additional nurses, transforming 20 young lives and making a significant contribution to increasing the health workforce. Based on GAIA's experience with more than 500 nurses supported through its program since 2005, these 20 nurses will use their incomes to support extended families and leverage their new positions to become role models for girls regarding what is possible with an education. In this way, each GAIA scholar has a ripple effect, lifting the woman and her family out of extreme poverty, giving her children better health and a better future, inspiring the next generation of young women, and strengthening her nation's health system.
Thank you very much, Dining for Women. You have improved the lives of women in Malawi through the Nursing Scholarship Program. Thank you.
Thank you for your involvement in Dining for Women, and to all the active members and chapters around the country whose generous support is changing lives.